Test.com's NCE Practice Test. For complete practice, try our full-length 800-question NCE Practice Exams Plus, including online flashcards, exam review, and a 50-state guide. A counselor intensifies a client's emotional state to show the client the irrationality of her emotional reaction. What is this technique known as? A. Paradoxical intention. B. Transactional analysis. C. Systematic desensitization. Or D. Reconfiguration. A. Viktor Frankl developed the technique of paradoxical intention and used it with clients who had severe anxiety. Transactional analysis is used by psychoanalysts to help clients determine their ego states in order to understand behavior. For behavior change, therapists help clients alter the state of their ego, parent, child, or adult-like. Systematic desensitization is a behavioral therapy technique developed by Wolpe to help clients overcome phobias. Despite its age, Kohlberg's theory of moral development is still in widespread use. Which of the following is the final level in the theory? A. Personhood. B. Principal thought. C. Self-actualization. Or D. None of the above. B. Principal thought comes after moving through the sixth stage, which Kohlberg believed few people actually reached. Self-actualization is the highest level of development one can reach according to Abraham Maslow's hierarchy of needs. Which of the following interventions is not commonly used in interpersonal therapy? A. Discussion of patterns in a client's relationship. B. A detailed past history of the client. C. Exploration of the therapist-client relationship. Or D. The ABC model. D. Interpersonal therapy is a short-term solution focused on treatment mainly for clients who have depression. The ABC model is a cognitive behavioral therapy technique developed by Albert Ellis to use when clients hold irrational beliefs. Members of a counseling group that score high in authoritarianism also tend to score high in independence. Is this true or false? False. Authoritarianism values strict obedience to authority, even if personal freedom is sacrificed, which is contrary to independence. If a child is learning to use abstract concepts, which of Piaget's stages is she in? A. Pre-operational. B. Sensory motor. C. Concrete. Or D. Early adolescence. D. Typically around the age of 11 or 12, children are moving into the formal operational stage, where they're learning to think about abstract concepts. The concrete operational stage is characterized by applying logic. Approximately how old is the child in question 5? A. 3. B. 12. C. 1. Or D. 8. B. Children typically move into the formal operational stage around the age of 11 or 12. If someone is thinking about committing suicide, asking them whether they are thinking about suicide will not cause them to commit suicide. Is this true or is it false? True. Research shows that talking about suicide does not increase the likelihood of someone committing suicide. Talking about suicide and educating people about it can be one of the most effective ways of preventing it from happening. Under which of the following circumstances is it not okay to break patient confidentiality? A. A court subpoenas the client's chart. B. The client has threatened to hurt himself or someone else. C. The client's employer has requested the information. Or D. The client admits to abusing his children. C. The patient's employer has no right to request information he or she shared in a confidential session with a therapist, even if it's through the Employee Assistance Program. Therapists are required to break confidentiality when someone's safety is at risk. Courts can subpoena charts, which is why therapists should be careful about taking notes during sessions. You are using the ABC model of cognitive therapy. Which model are you trying to promote in your clients after a negative event? A. Negative event leads to irrational belief, leads to positive thought. B. Negative event leads to rational belief, leads to healthy negative thought. C. Negative event leads to irrational belief, leads to unhealthy negative thought. Or D. None of the above. B. Albert Ellis developed the ABC model to help replace unhealthy, irrational beliefs with rational ones following a negative event. Carl Jung's theory of archetypes is still very influential, and several of them are listed below. Choose the one that is not correct. A. The shadow. B. The hero. C. The wise old woman. Or D. The self-made person. D. The shadow represents sex and life instincts and consists of repressed ideas and desires. The hero represents a champion defender. The wise old woman is helpful and a symbol of female nature. The mean, median, and mode are not at the same point on a normal curve. Is this true or false? False. The normal curve is symmetrical. Therefore, there's an equal number of values greater and lower than the peak, which then average out to be the mode, median, and mean. Which of the following kinds of therapy seeks to help clients find their answers to questions, such as why am I here? Is this all there is? Why do people suffer? A. Cognitive behavioral. B. Holistic health. C. Existential. Or D. Client-centered. C. Existential therapy centers on the client rather than the symptom, in its focus on free will, self-determination, and the search for meaning. It is not client-centered therapy because in this approach, therapists allow the clients to steer the conversation in an effort to get them to better understand themselves and others. Cognitive behavioral therapy tries to treat problems and boosts happiness by modifying emotions, behaviors, and thoughts. Holistic health therapy focuses on integrating the body, mind, spirit, and emotions. A client is 35. She is married, has 2 kids, and is working on a big promotion at work. She's focused entirely on her family and career. Which of Erikson's stages of psychosocial development is she in? A. Intimacy versus isolation. B. Generativity versus stagnation. C. Integrity versus despair. Or D. Industry versus inferiority. B. In the generativity versus stagnation stage, people are focused on contributing to the next generation, the client produced 2 offspring, and to society, the client's meaningful career. Industry versus inferiority occurs during the elementary school years, and integrity versus despair during late adulthood. It is not intimacy versus isolation, because she has gone beyond sharing her life with one other person. Kreitz is the researcher that first described the concept of career maturity. Is this true or is it false? False. Career maturity was first mentioned by Donald Super and is the degree to which people are prepared to make good educational and vocational choices. Kreitz created the career maturity inventory based on Donald Super's theory of career development. A dog is trained to salivate at the ringing of a bell. What form of conditioning is this? A. Classical conditioning. B. Operant conditioning. C. Reinforcement conditioning. Or D. None of the above. A. Classical conditioning occurs when 2 stimuli are repeatedly paired. In this case, the 2 stimuli were the ringing of the bell and the treat. Operant conditioning occurs when there are rewards and punishments associated with learning. Reinforcement is a term associated with operant conditioning. All humans have a 5-stage sleep cycle, and all cycle through the stages in the same order. Choose the correct sequence. A. Stage 1, Stage 2, Stage 3, Stage 4, Stage 5. B. Stage 1, Stage 2, Stage 1, Stage 3, Stage 5, Stage 4. C. Stage 1, Stage 2, Stage 3, Stage 4, Stage 1, Stage 2, Stage 5. Or D. Stage 1, Stage 2, Stage 3, Stage 4, Stage 3, Stage 2, Stage 5. D. Sleep does not progress through all of these stages in sequence, however. Sleep begins in Stage 1 and progresses into Stages 2, 3, and 4. Then after Stage 4 sleep, Stages 3, then 2 are repeated before going into REM sleep. Once REM is over, we usually return to Stage 2 sleep. Sleep cycles through these stages approximately 4 or 5 times throughout the night. The Fields and Levels approach to group career counseling uses one of the theories developed by which famous theorist? A. Jung, B. Rowe, C. Holland, or D. None of the above. B. Rowe's theory consists of 8 fields: service, business, contact, organization, technology, outdoor, science, general culture, and arts and entertainment, and 6 levels: professional and managerial, levels 1 and 2, semi-professional and small business, level 3, skilled, level 4, semi-skilled, level 5, and unskilled, level 6. Carl Jung founded analytical psychology. Holland created the Holland codes, including realistic, investigative, artistic, social, enterprising, and conventional. What traits originate in the cerebral cortex? A. Thought. B. Language. C. Reason. Or D. All of the above. D. The cerebral cortex is the most highly developed section of the brain and is responsible for these advanced skills. A conditioned association is not a learned association. Is this true or is it false? False. In operant conditioning, therapists believe the reaction to an object or event can be modified by learning or conditioning. What type of partial reinforcement produces the best response to stimuli? A. Fixed ratio schedules. B. Variable ratio schedules. C. Fixed interval schedules. Or D. Variable interval schedules. B. A variable ratio schedule is when a reward occurs after an unpredictable amount of responses and typically provides a high rate of response. A fixed ratio schedule occurs when a response is reinforced after a set number of responses. Fixed interval schedules reinforce the response only after a certain amount of time has passed. Variable interval schedules reinforce the response after an unpredictable amount of time has gone by. The archetype of the shadow encompasses which of the following? A. All that is evil. B. Everything that is wrong with a person. C. All of the things about a person that he or she will not acknowledge. Or D. None of the above. C. Carl Jung believed the shadow represented the dark side of someone's personality. A counselor that decides his consultancy fee job by job instead of setting a standard rate is using a variable ratio reinforcement schedule. Is this true or is it false? True. A variable ratio schedule is when a reward occurs after an unpredictable amount of responses and typically provides a high rate of response. The counselor's rate is unpredictable from one job to the next. A fixed ratio schedule occurs when a response is reinforced after a set number of responses. Fixed interval schedules reinforce the response only after a certain amount of time has passed. Variable interval schedules reinforce the response after an unpredictable amount of time has gone by. Some counseling methods are product-oriented, while others are process-oriented. Which of the following is more interested in the product than the process? A. Transactional analysis. B. Client-centered. C. Behavioral. Or D. None of the above. C. Behavioral counseling focuses on changing the client's behavior. Transactional analysis, developed by Byrne, focuses on interactions between people, and communication is very important. In this theory, it's believed that within each person, there are 3 altered ego stages: the parent, the adult, and the child. In client-centered, developed by Carl Rogers, the process is the focus and often guided by the client. Which type of memory retrieval requires a person to reconstruct a memory? A. Recall. B. Recollection. C. Recognition. Or D. Relearning. B. Memories are stored in the brain's hippocampus, and recollection occurs when a person needs to reconstruct a memory. Each time a person reminisces about an experience, that memory is strengthened. Recall designates that specific details be retrieved through memory. Recognition is the ability to recognize previously encountered people, events, or objects. Behavioral reinforcers always raise behavioral probability. Is this true, or is it false? True. The purpose of reinforcers is to increase the likelihood that a specific behavior will occur following a stimulus. For complete practice, try our full-length 800-question NCE Practice Exams Plus, including online flashcards, exam review, and a 50-state guide. What is one of the most important hallmarks of the formal operation stage of cognitive development? A. The ability to make rational judgments without concrete objects. B. The ability to reason deductively. C. The ability to plan for the future. Or D. All of the above. D. The formal operational stage is the last of Piaget's stages, beginning in early adolescence and lasting until adulthood, and is characterized by abstract concepts. What will the standard error of measurement tell you about a test? A. If the test is valid. B. If 2 sets of results are due to chance. C. If the test has a normal curve. Or D. If the test is norm-referenced. B. Standard error of measurement estimates how an individual's scores would fall if given the same assessment over a period of time. Validity is one of the most important criteria for determining the quality of a test, and refers to if the test is measuring what it claims to measure. The 4 lobes of the human brain are each responsible for handling different tasks. Which of these lobes is responsible for processing tactile sensory information? A. Occipital lobe. B. Frontal lobe. C. Parietal lobe. Or D. Temporal lobe. C. The parietal lobe processes information, temperature, taste, touch, and movement. The occipital lobe is responsible for vision, while the frontal lobe's main jobs include cognitive functions and voluntary movement. The temporal lobe processes memory and connects them with our senses. Which of the following would not be part of a standard first counseling session with a therapist who was practicing client-centered counseling? A. Introduction. B. Note-taking. C. Discussion. Or D. All of the above would be included. D. A large focus of client-centered counseling is discussion, often guided by the client. If a counselor's role changes from a non-forensic evaluative role to a therapeutic role, the client must be informed of the change as a matter of A. Confidentiality, B. Treatment, C. Informed consent, or D. Assessment. C. Informed consent is a process of getting permission before conducting a healthcare intervention on a person. Informed consent needs to occur before treatment. Who developed the technique of paradoxical intention? A. Wolpe, B. Super, C. Frankl, or D. Jung? C. Viktor Frankl developed the technique of paradoxical intention and used it with clients who had severe anxiety. Systematic desensitization is a behavioral therapy technique developed by Wolpe to help clients overcome phobias. John and Carol took the same test. John got a score of 87 and Carol got a score of 73. To determine if the differences in scores is the result of chance, a counselor would need to know which of the following characteristics of the test: A. Standard error of the mean, B. Standard deviation, C. Mean, or D. Standard error of measurement. D. Standard error of measurement estimates where an individual's scores would fall if given the same assessment over a period of time. Standard error of the mean is the variability of the sample means, while standard deviation is a measure telling the amount of variation of a set of data points. Who has most extensively researched and described the concept of career maturity? A. Ginsberg, B. Kreitz, C. Hoyt, or D. Super? B. While Super first described the concept of career maturity, it was Kreitz who researched and created the career maturity inventory. Ginsberg believed the development of the following 4 factors led to career choice: the reality factor, the influences of the educational process, the emotional factor, and individual values. Hoyt viewed career education as a composite of activities and experiences designed to prepare and engage individuals in paid or unpaid work during their lives. Super believed the following stages explain career development: 1. The crystallization stage, ages 14 through 18. 2. Specification stage, ages 18 to 21. 3. Implementation stage, ages 21 to 24. And 4. The stabilization stage, ages 24 to 35. 5. Consolidation, age 35. And 6. Readiness for retirement, age 55. The correct order of Piaget's 4 stages is A. Formal operational, pre-operational, sensory motor, concrete operational. B. Pre-operational, formal operational, concrete operational, sensory motor. C. Concrete operational, sensory motor, pre-operational, formal operational, or D. Sensory motor, pre-operational, concrete operational, formal operational. D. Piaget was a developmental theorist who believed all people went through the same 4 stages. The main goals of each stage follow: sensory motor, object permanence, pre-operational, symbolic thought, concrete operational thought, and formal operational or abstract concepts. John Bowlby is associated with A. Career guidance, B. Attachment and bonding, C. Psychodrama, D. Holistic counseling. B. Bowlby's work was the beginning of attachment theory, which describes how the parent-sibling bond and/or attachment later influences how a person develops. Parsons, Holland, Bandura, and Super are associated with career guidance. Marino founded psychodrama, also known as the first type of group therapy. Culture can be defined as A. Values a group shares and learns from the other members of the group. B. Attitudes, beliefs, art, and language specific to a group. C. Customs shared by a group which are different from those in another group. Or D. All of the above. D. Culture is a broad term used to describe the social behavior and norms found in human societies, and therefore A, B, and C are all part of that definition. An oversimplified way of thinking about culture is as a way of life for certain groups. Cultural norms: A. Measure conduct. B. Describe how people belonging to a certain group are supposed to act. C. Show how to interact with someone from another culture. Or D. Were first described by Freud. B. While understanding cultural norms may help you understand the behavior and actions of someone from another culture, thereby making it easier to interact with that person, they do not provide a roadmap showing how to interact. Talking about difficulties to purge them is a curative process, known as A. Catharsis. B. Problem solving. C. Release. Or D. Sounding off. A. While Aristotle was the first to describe catharsis, it was the psychoanalyst Joseph Breuer who first used it as a technique. He found that while recalling traumatic experiences under hypnosis, his clients experienced relief after expressing the repressed emotions. Which theorist spoke of social connectedness? A. Freud. B. Jung. C. Adler. Or D. Skinner. C. Social connectedness is the measure of how an individual is connected to and takes interest in the well-being of others. Adler believed when people reached a level of social connectedness, they would feel successful and happy. The other theorists mentioned above adhered more toward an individualistic explanation of success and happiness. The difference between open and closed groups is: A. In an open group, confidentiality is valued less than in a closed group. B. Group members are allowed to drop out of an open group, but not a closed group. C. Group members need to be screened for closed groups, but not for open groups. Or D. No new members can join a closed group, whereas new members can join an open group at any time once they've been screened. D. In closed groups, the group typically ends with the same members it began with. New members are not allowed to join a closed group once the sessions have started, but members are allowed to drop out at any time. Counselors need to screen members for both open and closed groups. In open groups, new members can join in at any time once they've been screened. Regardless of the type of group, confidentiality is always an important aspect, so that group members can trust one another and the counselor. An advantage of having co-leaders for a group is: A. If one leader is unable to be there for the meeting, it does not have to be counseled. B. The leaders can process their own feelings with each other in between sessions. C. The leaders can be more observant of group dynamics. Or D. All of the above. D. As long as the co-leaders get along and adhere to a similar theoretical approach and vision for the group, having co-leaders can provide multiple benefits for group members. Which theorist believed a person's personality needs to be congruent with their work environment? A. Holland. B. Parsons. C. Freud. Or D. Marino. A. Holland believed that if a person chose to work in an environment congruent with their personality, they would feel happier and more satisfied. The 6 work environments he identified are realistic, investigative, artistic, social, enterprising, and conventional. Parsons believed careers had to be matched to talents, skills, and personality. Which person is associated with the beginning of the guidance movement? A. Adler. B. Parsons. C. Freud. Or D. Ellis. B. Frank Parsons is known as the founder of the guidance movement. His talent-matching approach was later developed into the trait and factor theory of occupational choice. Adler was the founder of individual psychology. Freud was the founder of psychoanalysis, and Ellis was the founder of rational emotive behavior therapy. What does RIASEC stand for? A. Realistic, instigating, artistic, social, enterprising, conventional. B. Realistic, investigative, artistic, social, enterprising, conventional. C. Reformed, investigative, artistic, social, enterprising, conventional. Or D. Realistic, inquiring, artistic, social, enterprising, committed. B. Career theorist John Holland developed these 6 categories describing different work environments. He believed an individual's personality needed to match their work environment in order to maximize happiness and success. Which is not an example of a computer-assisted career guidance system, or CACGS? A. Siggy Plus, B. Choices, C. Indeed, or D. Discover. C. Siggy Plus, Choices, and Discover are all types of CACGS. CACGS is a term used to describe a computer program that combines career assessment, information, and guidance all into one system. Indeed is a popular job search website. Most ethical dilemmas are related to A. Family members, B. Confidentiality, C. Money, or D. Mental illness. B. An ethical dilemma occurs when a counselor feels pulled in 2 different directions. In surveys of practitioners, confidentiality is one of the top dilemmas reported. One of your clients who is a minor comes into your office with visible bruising and you suspect abuse. You should A. Call the child abuse hotline to report the incident. B. Tell his parents to stop abusing him. C. Try to prove it. Or D. Ask lots of questions to lead your client to confide the abuse to you. A. It is very important for counselors to follow through with reporting abuse, especially since they are mandated reporters. This is one of the instances when breaking confidentiality is warranted. It is not the counselor's job to get more information from the client in order to try to prove abuse occurred. If a counselor has the suspicion that abuse occurred, they need to report. In some instances, counselors do choose to let the parent know a report had to be made, but that is not required. Which test measures key personality factors? A. WISC, B. WAIS, C. MBTI, or D. 16PF. D. The 16 Personality Factor Questionnaire, or 16PF, is a self-report personality test developed using several decades' worth of empirical research. Cattell and his associates set out to measure the following personality factors: warmth, intellect, emotional stability, aggressiveness, liveliness, dutifulness, social assertiveness, sensitivity, paranoia, abstractedness, introversion, anxiety, open-mindedness, independence, perfectionism, and tension. The Myers-Briggs Type Inventory is a self-report personality inventory which indicates how people perceive the world and make decisions. The WISC and the WAIS are tests designed to measure cognitive intelligence. The most valuable type of research is the A. Correlational study, B. Experiment, C. Survey, or D. Descriptive narrative. B. The experiment is the most powerful research method because it is the only design that examines a single factor's effect on a particular behavior. Therefore, it is the only method where a direct cause and effect relationship can be established. While correlational studies can show if two variables are related and how strong the relationship is, it is important to remember correlation does not equal causation. A man comes to you and has been through a series of traumatic events. You have no training or experience in helping clients overcome trauma. Ethically, you should A. Continue meeting with him and learn as you go. B. Tell him you can't help him. C. Refer the client to a therapist who has the proper qualifications. Or D. Ask him to tell you all the details. C. Helping clients work through trauma requires specialized training. If the client is presenting with trauma and it is out of the realm of the counselor's ability to handle, the client should be referred to a qualified professional. Thanks for watching Test.com's NCE Practice Test. For complete practice, try our full-length 800-question NCE Practice Exams Plus, including online flashcards, exam review, and a 50-state guide.